Commonwealth Plastic Surgery prioritizes your comfort, care, and privacy with all consultations and procedures.
And today we have board-certified plastic surgeon Dr. Jared Nimtz. He joins us here to talk about his practice, about facial fat grafting. We are so glad to have you in here talking once again with us. And before we came on, you were pointing out some really interesting things about this whole process. So break it down for us.
Yeah, when we all age, we tend to develop wrinkles in our face, but we also tend to lose volume. And so to replace that volume, people wind up going to med spas or perhaps coming to my office and in the interest of finding filler, okay? And they put that filler, which is kind of like a jelly, in their face to plump it back up again. And I brought some little show and tell items. This is about what you'll get as a syringe of filler. Costs about $700 or $800 and it lasts about 9 months, all right? And then you have to put in more and more. But if someone were to come to me and if they needed more volume, then I might do what's called facial fat grafting. I might borrow some fat from somewhere else on their body, and I borrow about this much fat, and then I would put about half of that back in the face, and it's not that much more expensive. And that fat actually winds up lasting longer for them.
Okay, like how much longer are we talking?
So usually a syringe of filler may last 9 months or so, and the fat grafting may last 3 to 4 years.
So with the fact that you are taking some of this fat and transferring it elsewhere, is the procedure relatively easy?
It's straightforward. We do it in the office. You do not have to go to sleep for it, okay. So it's just a little bit of local so that we can borrow that fat.
All right, so again, just a little local, so you get numbed, and then you pull it out, and then you just you reapply it to another part
Basically,
of the body.
yeah.
So, I mean, it's all you. It's coming from your body.
Right. It's kind of like the ideal situation. People used to always ask, well, can't you just suck this out and put it here? And the answer is yes, we can. So,
now, are there any circumstances where you cannot take the fat from some specific spot?
If somebody had certain health conditions, yes. So this does not apply to everybody, but the bulk of people, yes, this is good for them.
Okay,
all right, now
perfect.
All right, so we can find more information on Commonwealth Plastics website, which is commonwealthplastics.com. So again, right here, you would fill this up and put about half of it back in. That's
exactly.
what you're talking about.
Exactly.
Of your own
own fat. So it feels softer. It feels more natural because it is natural. It's your own body.
It's you.
Perfect.
Yeah. Excellent. All right.
Well, thank you so much for being here and explaining that. Yep. I know many people now will look to get that instead of,
Well, I'm getting ready. As soon as we go to commercial, I'm going to ask. I'm going to talk to you.
Ask.
All right. So